Hi, my name is Dr. Robin Lee of Bay Area Foot and Ankle Associates, and today I will be talking about running shoe tips for shin splints. First, some disclosures and potential conflicts of interest. I am a member of the Forward Motion Race Club, and this club is sponsored by Forward Motion Sports, a running specialty store in Danville. Just some background information on myself. I graduated from podiatry school in 1998 and from residency in 2000. And I'm also a certified personal trainer and certified running coach by the Roadrunners Club of America. And I've been a runner since middle school, and I am a current age group competitor and fun run. And these days I like to run in costumes just to keep things fun. So shin splints, there are two main types. There's the shin pain at the front of the shin. We call it anterior shin splints. And then there's runners who experience pain at the instep side of the shin. That's called medial or posterior shin splints, or the more technical term these days is medial tibial stress syndrome. So what causes shin splints? One cause is excessive impact shock and torque to the lower extremity or the shin area, and this would lead to direct bone injury like a stress reaction or a stress fracture. This is actually less common. More commonly, the muscles that attach to the shin bone or tibia become strained when they try to control the shock and torque. So for people with the shin splints at the front of the shin, the anterior tibialis muscle strains to control the foot slap as it tries to keep the front of the foot from slapping on the ground too hard upon heel contact. And for the patients with the medial or posterior shin splints or that medial tibial stress syndrome, the posterior tibialis muscles strain to control the pronation that happens when the foot makes contact on the outer part of the heel, which tends to twist the heel upon the shin bone. So for my runner patients with shin splints, there are two main things I always look for in their shoes. One is to see if their shoe has a beveled or rounded heel, and the other item I look for in the shoe is to make sure that the foam or the midsole of the shoe is actually compressible. Conversely, what you want to avoid in a shoe is a shoe with an unbeveled heel, so a shoe with a block shape or outflaring. Typically, you'll find a block shape in the heel of the shoe in a court shoe like this tennis shoe or basketball shoe. And the outflaring, sometimes you'll find it in retro shoes like this old school Nike Cortez. Essentially, if you land on the edge of the block or the outflare, this creates a pivot point with a bigger lever arm that increases the torque resulting in foot slap and leads to greater intensity of shin splints. Another thing to avoid in shoes for those who have a history of shin splints is to avoid any kind of energy return material in the strike point area of the shoe. This energy return material, whether it's a gel, some springs, or coils, usually makes the midsole less compressible and you lose that crumple zone effect. So in this shoe over here, this New Balance shoe, I'm putting all my weight on it and it barely compresses as far as the shock absorbing foam, whereas this has standard EVA foam and it compresses down, giving me more of a crumple zone effect and actually providing more shock absorption. And another component to look for in shoes, especially for the runner that suffers from medial or that posterior shin splint, is some pronation control device in the shoe. Usually it's some sort of firmer material on the instep side of the shoe in the midsole. It's usually signified by a darker material, or typically dark gray material on the instep side of the midsole of the shoe. So you're looking for a dual density or multi-density midsole. Sometimes the shoe will have a piece of plastic on the instep side. They call it a roll bar, or just generically, it's called a medial post, as far as just putting something on the instep or medial side of the shoe to post the shoe and reinforce it. So having pronation control is important for the medial or posterior shin splints, as I mentioned. It also is helpful if you have other symptoms that involve the instep side of the ankle, like posterior tibialis tendonitis, which is inflammation of that same tendon where it inserts in the arch of the foot, or tarsal tunnel syndrome. So shoes aren't the only thing I check with my patients with shin splints. Some other risk factors include the running form. I check whether to see if they are a heel striker or a midfoot striker. Typically, the heel strikers tend to develop the shin splints more commonly. Also, I look at their propulsive phase or push-off phase of gait to see if they are more hip dominant or ankle dominant. The ankle dominant runners tend to develop more shin splint problems because they're using the muscles in their lower legs more and their foot muscles more. Whereas the hip dominant runners tend to use more of the glutes and hamstrings. That's where the phrase recruit the glutes come in for more advanced runners. Also, I evaluate my patient's functional or postural strength. This is important for maintaining proper form and posture and body alignment through the course of running. Basically, I check to see how much their knee buckles when you're landing on that extremity, and also check for other things like see how much hip drop they have on the swing limb hip, and other things, basically to check how raggedy they look. So other things would be to check to see how much their head bobs from side to side. All this is important. The stronger you are from a postural standpoint, the less unintended wear and tear happens to your body, particularly to the musculoskeletal system. And this also improves your running economy and running efficiency. This concludes my presentation on running shoes and shin splints. I hope this information was helpful. Thank you for your time and attention, and go make today a great day. Thanks.